Good evening, everyone. Thank you so much for being with us. I'm Rudy Trevino.
And I'm Leslie Adamy. At the top tonight, our state now has the fewest available ICU beds it's had during the entire COVID-19 pandemic. This as hospitalization rates across the state continue to see an all-time high. Here in Nueces County, 300 people are currently in the hospital battling COVID-19 tonight. Of those, 71 are in the ICU. County officials tonight warning the public hospital resources are limited. You may have received this alert from local officials today. Area leaders sent this reverse alert this morning about the region's COVID-19 situation. Now they say healthcare facilities are open, but resources are limited, a trend that's becoming too familiar in Texas as Austin and Houston report similar situations in their communities. Now, we've been reporting daily on the number of COVID-19 cases and hospitalizations in our area now for 18 months, and unfortunately, those numbers are once again on the rise. Nueces County tonight reporting 425 new cases. The county now at more than 4,000 active cases reported. And on this Tuesday, 9 COVID-19 related deaths were also reported. Texas state health officials reporting tonight 1 out of every 4 hospital patients in Corpus Christi are in the hospital for COVID-19. That is higher than any of the other 22 hospital regions in Texas. Our Ashley Gonzalez caught up with local officials and paints us a picture of what our area hospitals are experiencing right now and what could happen if the community's behavior doesn't change soon.
The COVID-19 surge is overwhelming our hospitals. Nurses and staff are being overworked, and patients are filling up beds faster than they can be staffed. That's why area medical officials are working with the state right now to get some help.
We are having to send our patients out of our county, out of our district, to other hospitals that are also stretched thin.
Mid-July was the start of a new COVID wave. Flash forward to now. That wave has turned into a tsunami, which could get worse. These graphs project what we could see very soon if people's behavior does not change.
Now we're going to hit a peak in hospitalizations in a week or two, and the other one says that hospitalizations are going to go to the moon.
In most places, you are not required to wear a mask, and vaccines are still optional in most cases. Yet, those two little things serve as defense against COVID. And as of late, experts say local folks have been acting careless. So our healthcare heroes pay the price.
There's about 1,750 people in the hospital. Outside of COVID times, the model is predicting there could be 1,500 COVID patients, or at least people needing hospitalization at the peak if our behavior doesn't change. From my estimation, I think this amount of people is more than the hospitals are designed to address.
On Tuesday, the Coastal Bend Regional Advisory Council said they've been in contact with the state to get help from outside of Texas since hospitals statewide are hurting for more hands. They sent 3 News this statement. CBRAC are rapidly coordinating with area hospitals to submit requests to fill staffing needs that will enable our hospitals to open up more beds and care for our community. Public, please do your part. Get vaccinated and practice social distancing and masking. The help can't come soon enough.
This is back to where we were a year ago. You know, I talked to my colleagues, and everybody is tired. We've been fighting this for a year and a half.
Word on if or when out-of-state nurses will come to the Coastal Bend has not yet been released, but we'll keep you updated. Ashley Gonzalez, 3 News.